Reliability and validity. Regarded by most as the most important measurements of the quality of a test or assessment tool. Let's dive in and begin with reliability. The term reliability refers to the measurement of the consistency of scores or responses with any test or assessment tool. There are several types of reliability. Let's take a look at two examples. First is what is called test-retest reliability. This is a measurement of the consistency of test results across time by testing and retesting individuals to compare the results. For instance, let's imagine that you're working with a patient named Bob, and you give him a test that determines that he has obsessive-compulsive disorder, typically a chronic condition. Now, if you retest him a couple days later, will the results come back the same? How consistent the results are when individuals are tested and then retested is what we refer to as test-retest reliability. Next, we have inter-rater reliability. This is a measurement of the consistency of responses across raters. For instance, if 3 different doctors use the same manual to diagnose Bob, how consistent will they be in their diagnosis? There would be great inconsistency or low inter-rater reliability if Dr. A diagnoses Bob with bipolar disorder, while Dr. B determines it's ADHD, and Dr. C thinks Bob has borderline personality disorder. When using the same test or assessment tool, it is very important that most, if not all raters, in this case doctors, draw the same conclusions. Okay, so what about validity? Validity is a measurement of the extent to which a test measures what it is supposed to measure. For instance, to what extent did the IQ test that I just administered to Bob actually measure his intelligence? Like reliability, there are several types of validity. Let's take a look at 3 examples. Content validity is a measure of the extent to which the content of the test matches the test's objectives. For example, with Bob's IQ test, it would be valid for the test to include questions that measure Bob's processing speed. However, it would not be valid to include questions that assess Bob's love interests. Let's take a closer look in the question corner. Which question do you think is most valid for a test that assesses one's mood? A, do you like mystery novels? B, have you felt more depressed than usual? C, how frequently do you have diarrhea? Or D, do you hear voices in your head? If you picked B, then you got it. The most valid question in the assessment of one's mood is B. Have you felt more depressed than usual? Okay, back to the board. Predictive validity is a measurement of the extent to which the test can make accurate predictions. For instance, if Bob's IQ scores are high, can I predict that this means he will be successful in school? If this were true most of the time, we could say that the IQ test has high predictive validity with school performance. And finally, construct validity. This is a measurement of the extent to which the test measures the intended constructs, like intelligence, personality, and depression. If we have Bob take this self-report depression inventory, how accurately will it measure the construct of depression? More importantly, how accurately will it measure depression if I administer it to 1,000 patients? The results of such an inquiry would determine the test's construct validity.